Welcome back to the lecture series on periodontics. In this video, we will be discussing about the circumferential sutures, which are falling under the category of interrupted sutures. So today we will learn about the technique, indications, advantages and disadvantages of this suturing method. The first bite is taken through the buccal flap, 3 to 4 mm from the tip of the papilla, and needle is passed through the embrasure beneath the contact area to the lingual side. On the lingual side, second bite is taken through the connective tissue side of the lingual flap, also 3 to 4 mm from the tip of the papilla. Needle is then passed back through the embrasure to the buccal side. The knot is tied on the buccal side using a surgeon's knot 2-1 technique. 2 throws are given in clockwise direction and initial knot is stabilized, and 1 throw is given in anti-clockwise direction. This is ensuring a secure and stable knot. Excess suture is trimmed, ensuring 2 to 3 mm ends are left. Proper trimming prevents irritation. Next, let us discuss about the indications of the circumferential sutures. It is the most common suturing technique used in the periodontal flap surgeries. So this technique is also used in the partial or the split thickness flaps, and it is also used in the apically positioned flaps. This technique is effective when vertical incisions are given, and it is also used in the bone regenerative procedures. Next, let us discuss about the advantages of this technique. So this suture is providing the independent stability. So each suture is independent. They are not interlinked. If one suture becomes loose, it is not affecting the stability of another suture. And this technique is easy to place because it is a straightforward technique. And disadvantages of the suture is there is always a risk of the surgical site exposure. So that means here if one suture is cut or if it is loosened, then there is a chance for the flap to become unstable. So leading to the exposure of the surgical site. Because sutures here are independent, they are not linked with each other. So there is always a chance for surgical site exposure only if the suture is cut or if it is loosened. If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.